So my topic was congenital heart defects. Congenital heart defects is an abnormality or defect in the heart that is present at birth, which is actually what congenital means present at birth. This occurs in such a way that there is a hole in the heart or that there is a missing or poorly formed portion of the heart. This often results because of a incomplete or faulty development in the heart in the early weeks of development. There are many different types of congenital heart defects, such as there are four main common ones: atrial septal defect, ventricular septal defect, tetralogy of Fallot, and patent ductus arterius. There is also coartication of the aorta, detransposition of the great arteries, and also tricuspid artesia are just a few of a long list of different congenital heart defects. And next we have, we'll be reviewing the etiology of it, the demographics, the anatomy, the physiology, and the symptoms, diagnosis and treatment, and some AIs that are being developed. Etiology is talking about risk factors. Some risk factors are um, really none specifically because anyone can have a child with um, CHD, congenital heart defects. But if you have a family member who has it, it's a possibility that you are more than likely to have it. Smoking or secondhand smoke also can affect it. Um, Taking certain medications can affect it. And also certain medical conditions such as diabetes or other things can affect it. They also say that it is slightly more common in men than in women, unless the woman has Down syndrome. And they do say that the genetic, that there might be a genetic risk factor as well, which is when they're specifically talking about children with Down syndrome more likely to have CHD. And there are no AIs that determine risk factors for CHD. Here are some demographics for CHD. Uh, about 1 in 4 babies who have CHD have a critical severity and require surgery in the first year of their lives. They also say that about 1%, or about 40,000 births per year in the United States, children have CHD. They also have done research and found out that about 95% of babies born with non-critical congenital heart disease are expected to survive to 18 years of age. Uh, Congenital heart disease is the same as congenital heart defects. The two terms are interchangeable, but defect is a more accurate representation of what actually happens. Next, we have down here in this corner, you can see that in the United States, hospital costs for the population of individuals with CHD totals to about 1.8 billion. So it is a very costly procedure, but it is a very common disorder in children. In order to understand the anatomy of CHD, you have to first know the anatomy of the normal heart. So here I have a picture of the normal heart, and it's I have a picture of the way that it goes throughout the heart. We start off with deoxygenated blood. So that's blood without oxygen. It's going to travel through the heart, through the veins right here, and into the inferior posterior vena cava, into the right atrium, which is here, then to the right ventricle, and then over through the pulmonary artery, and that'll bring the deoxygenated blood to the lungs. The blood then becomes oxygenated, which is good, which is what we want, so that when it goes to our body, it can give oxygen to our muscles in order to perform their activities. So from the lungs, it goes from the pulmonary vein to the left atrium, so enters through here, down into the left ventricle here, and up through the aortic valve into the aorta, and then it can travel to different parts of the body through the arteries. That is how a normal working heart does what it needs to do for our body. So the physiology of a child or an adult with CHD, depending on which type of CHD they have, it'll be different. These are the 4 most common types. Congenital heart disease, like I said, is the same as a congenital heart defect. Here we can see the patent ductus arteriosus, and that is where it remains open. There's an opening right there, a little hole that is performing like a leak. Here you could see that the tetralogy of the phalate, the septum right here, that you would see right here, the ventricular septum, is not completely closed. And so that would create a problem with the oxygenated and deoxygenated blood. Right here, you can see the malformation of the aorta getting very small there, and also there being a leak over here in the foramen ovale of the heart. So these are 4 different kinds, and you can see how it's affecting it. Some complications that can arise from these would be blood clots, endocarditis from inflammation from these types of malformations in the heart, emotional health issues, arrhythmias. Also, they say that most people or children with CHD also end up having certain developmental disorders. Next, we move on to symptoms. So here's a baby that had a surgery for his congenital heart defect. As you can see, he looks really happy, but also he has this really big scar along his chest. Some symptoms to be seen with this type of disease would be cyanosis, or in other words, like blue tinted skin, nails, or lips. The baby would turn blue. Sleepiness or fatigue. They would also have respiratory issues and have trouble breathing or hyperventilating, and also tiredness when feeding. They may also have a lack of response to the parent's voice or touch. A sense of limpness is more specific to the tetralogy of phalate defect that I had showed you above, and also unusual fussiness is more specific to that one as well. Diagnosis. During pregnancy, the only type of diagnosis is a fetal echocardiogram. And then after, as a baby or as an adult, they would do a physical examination of the heart and the lungs with a stethoscope. You can also perform a chest x-ray to show whether the heart is enlarged or to see whether the lungs have extra fluid in them, which is a sign of heart failure. Genetic testing, you can also see if your child potentially has Down syndrome, which would be a risk factor for CHD. And also an electrocardiogram can be performed to evaluate the rhythm of the heartbeat. Certain treatments for this, this is a more approach before surgery would be a cardiac catheterization, which measures the pressure and the oxygen level inside the heart. This can help figure out whether the blood is flowing from the heart one side to the other instead of going to the rest of the body. Surgeries are also done to repair the heart or the blood vessels. That's in more severe cases. Ibuprofen or Tylenol might be given to reduce the inflammation. And it also can help with the patent ductus arteriosus defect to help close that little hole. In more severe cases, one might even need a heart transplant or a palliative surgery, and that's in order so that that can just hold a child over in order to improve oxygen levels in the blood for a surgery later on if a surgeon needs to install a shunt or do a full repair later. Artificial intelligence, there were only 2 that I found, and they weren't in fact in use yet. They were still in research stages. The first one is Riken AIP, Advanced Intelligence Project, and this looks at fetal heart images. This allows them to look at the position and classify other multiple objects appearing in the images to distinguish whether or not the child has the congenital heart defect or not. And in another AI, I found artificial neural network, and they compare many cases of different heart sound analysis to normal heart sounds and heart sounds of children and adults with congenital heart defects. And this is my reference page, and that is all.